It's 3 o'clock in the morning. The house is quiet. The room is dark. You wake up with that familiar pressure telling you it's time to use the bathroom again. So, you sit up, slide your feet to the floor, and start walking a path you've walked 1,000 times before. For many adults over 60, this feels like a normal part of getting older. Annoying, maybe. Disruptive, yes, but not something that seems especially risky. Most people focus on the bathroom part. Why am I waking up? Is it my bladder? Did I drink too much water? Is this just age? But here's what many people miss. The bigger issue may not be waking up to urinate. The bigger issue may be what happens after you get out of bed. That short walk from the bedroom to the bathroom can become one of the most overlooked safety moments of the night. Not because something dramatic is happening, but because several small things can come together at the same time: darkness, sleepiness, stiff legs, slower reaction time, reduced vision, urgency, medication effects, loose slippers, a rug edge, a wet bathroom floor. Any one of those may seem minor. Together, they can change the whole situation. This video is for education only. It is not medical advice, and it cannot tell you what is causing your symptoms. If nighttime urination, dizziness, balance changes, medication side effects, near falls, or new symptoms are affecting your life, it is worth discussing them with a qualified healthcare professional. Now, think about what your body is doing in those first few seconds after waking. You have been lying still for hours. Your muscles may be stiff. Your joints may not feel fully ready. Your eyes are adjusting to low light. Your brain is not completely alert yet. Your balance system is moving from rest into action. Then, almost immediately, you stand up and walk. That timing matters. After 60, the body can still be strong and capable, but it may not recover from sudden transitions as quickly as it once did. You may need a few extra seconds to feel steady. Your eyes may need more light. Your feet may need better support. Your brain may need a moment to fully wake up. That does not mean you should panic. It means this routine deserves more attention than most people give it. One reason nighttime bathroom trips can become risky is that the home feels familiar. Familiarity can make us careless. You know where the bed is. You know where the hallway is. You know the turn into the bathroom. So, you may not turn on the light. You may not look down. You may hurry because the need feels urgent. But the house you know well in daylight is not exactly the same house at 3 in the morning. A small rug edge that is easy to see during the day may disappear in the dark. A pair of shoes near the bed may become an obstacle. A laundry basket, a pet, a cord, or a slightly open drawer be enough to interrupt your step. And when you are half asleep, you may not respond as quickly. That is the part many people underestimate. A fall often does not start with a major hazard. It starts with a tiny mismatch between what the body expects and what the floor actually does. Vision is a major piece of this. As we age, many people need more light to see clearly. Low light vision can become less sharp. Glare can be more bothersome. Depth and contrast may be harder to judge in a dark room. Your eyes help your balance more than most people realize. When the room is dark, the body has to rely more on the feet, joints, and inner ear to stay oriented. If your feet are numb, your legs are stiff, your balance is not what it used to be, or your medication makes you a little groggy, the dark becomes more than an inconvenience. It becomes part of the risk. Sleepiness adds another layer. Those first moments after waking are not the same as being fully awake. You may know where you are, and you may feel alert enough to move, but your reaction time and judgment may still be catching up. That is why someone can make a simple mistake at night that they would never make during the day. They turn too quickly, they step around the bed too closely, they reach for the wall and miss, they misjudge the bathroom threshold, they step onto a wet spot without seeing it. None of this means a person is weak or careless. It means the body and brain are being asked to move before they are fully ready. Another detail worth noticing is what happens when you first stand up. Some adults feel lightheaded, dizzy, or briefly unsteady when they move from lying down to standing. Sometimes this can be related to a temporary blood pressure shift when the body changes position. Sometimes it may be connected to hydration, medications, health conditions, or other causes that need a professional review. The feeling may pass in a few seconds, so it is easy to dismiss. But if those few seconds happen at the start of a dark walk to the bathroom, they matter. The key is to notice the pattern. Do you feel unsteady right after getting out of bed? Do you need to hold the knit stand before walking? Do you feel dizzy only at night? Or also during the day? Have you had a near fall, even if you caught yourself? Have you started waking up more often than before? These are not things to be embarrassed about. They are useful clues. And if they are new, worsening, or happening repeatedly, they are worth asking your doctor about. Medications and supplements can also be part of the conversation. Some medications may contribute to sleepiness, dizziness, changes in blood pressure, or balance issues in certain people. Some supplements may also interact with medications or add effects that are easy to overlook. This does not mean you should stop taking anything on your own. Never change or stop a medication without guidance from your healthcare professional. But if nighttime unsteadiness has become a pattern, it is reasonable to ask your doctor or pharmacist to review what you take, when you take it, and whether any combination could be contributing. Sometimes the question is not, is this medication bad? The better question is, could the timing or combination be affecting my balance at night? Alcohol is another factor that deserves an honest look. Even a small amount may affect sleep quality, reaction time, balance, and nighttime alertness for some people. It can also make bathroom trips more likely for certain individuals. That does not mean every person has the same response. But if nighttime bathroom trips and unsteadiness are becoming a concern, alcohol is one of the patterns worth observing. Then there is footwear. Loose slippers are comfortable. They are easy to slide into. Many people keep them beside the bed for exactly that reason, but comfort is not the same as stability. A slipper that shifts, bends, catches on carpet, or slips off the heel can create a problem during a sleepy walk. Bare feet can also be risky on smooth floors, especially if there is water in the bathroom. The goal is not to buy some special product. The goal is to ask a simple question: does what I wear on my feet at night make me more stable or less stable? The same question applies to the path from the bed to the bathroom. Is it clear? Is it well lit? Are rugs secure? Are cords out of the way? Is there clutter near the bed? Is the bathroom floor dry? Can you reach a light without stretching or stumbling? These questions may sound basic, but basic is exactly where many preventable problems live. A fall at night often happens in ordinary places, during ordinary movements, in a home that feels safe because it is familiar. One common mistake is rushing. Urgency can make a person move faster than they should. The mind says, I need to get there now, but the body may need a moment to steady itself. Even a short pause at the edge of the bed can change the rhythm of the whole trip. Sitting for a few seconds, placing both feet on the floor, noticing whether you feel dizzy, and standing slowly may help you avoid starting the walk before you feel ready. Another mistake is refusing to use light. Many people avoid turning on lights because they do not want to wake themselves fully or disturb someone else. That is understandable. But total darkness is not a safety strategy. A small night light, a hallway light, or motion-activated lighting may give enough visibility without making the room feel bright. The goal is not to make the night feel like daytime. The goal is simply to see the floor, the path, and the bathroom entrance clearly enough to move safely. Another mistake is ignoring near falls. If you stumble and catch yourself, it is tempting to say, nothing happened, but something did happen. Your body gave you a warning without an injury attached to it. A near fall is not a failure, it is information. It tells you there may be a hazard, a timing issue, a balance issue, a medication issue, or a pattern that needs attention. That is a much better time to make changes than after an injury. It is also important not to treat frequent nighttime urination as something you must simply tolerate. Many people experience it, and sometimes it has simple explanations. But when it is new, worsening, disruptive, or connected with urgency, pain, dizziness, swelling, excessive thirst, medication changes, or daytime symptoms, it deserves a medical conversation. The point is not to assume the worst. The point is to stop guessing. A doctor can help evaluate possible causes, and a pharmacist can help review medication timing or possible side effects. That kind of conversation is often more useful than trying to solve the problem alone. There are several red flags that should not be brushed aside. If you faint, fall, hit your head, feel chest pain, have sudden weakness, severe dizziness, confusion, trouble walking, sudden vision changes, or new numbness, seek medical attention promptly. If you are having repeated near falls, worsening balance, dizziness when standing, or nighttime bathroom trips that are increasing quickly, bring it up with your healthcare provider. And if you suspect a medication is involved, do not stop it on your own. Ask for a professional review. What makes this issue so important is that it sits at the intersection of two things older adults care about deeply: sleep and independence. Waking up at night is frustrating, but falling at night can affect confidence. It can make a person afraid to move freely in their own home. It can change routines, reduce activity, and create anxiety that lasts long after the moment itself. That is why prevention is not about fear. It is about protecting the life you already have. A clearer path, better lighting, safer footwear, a slower transition from bed to standing, a medication review when symptoms appear, a conversation with a doctor when nighttime urination changes. These are not dramatic steps, but they can be meaningful, and they all begin with seeing the nighttime bathroom trip differently. Not as a harmless routine to rush through, not as something to panic about, but as a brief moment when your body needs your attention. So, tonight, or the next time you wake up in the dark, notice the pattern. Notice whether you feel steady before you walk. Notice whether the floor is clear. Notice whether your slippers help or hinder you. Notice whether you are rushing. Notice whether this has become more frequent than it used to be. Those observations are simple, but they are not small. They can help you have a better conversation with your doctor. They can help you make your home safer. And they can help you protect something that matters deeply after 60, the ability to move through your own home with confidence. This video is for education only and is not a substitute for medical advice. If you have frequent nighttime urination, dizziness when standing, medication concerns, balance changes, near falls, or symptoms that are new or getting worse, please speak with a qualified healthcare professional. The goal is not to be afraid of the night. The goal is to make the night safer, because sometimes staying independent is not about one big decision. Sometimes it begins with a slower step, a clearer path, and enough light to see where you are going.